Good day, good afternoon, and buenos tacos to everyone. You're now enjoying another episode of What's Up Aboard TV and What's Up Aboard the podcast. For those of you who may not know, we are a self-help podcast that focuses on love, life, and everything in between. Remember, everyone has a story to tell, but we just want to know what's yours. Please remember to tap that like, follow, and subscribe button. That helps us to help you help each other. And sharing is always free 99. So please tell a friend if you heard something here today that you like. Today, we have a phenomenal guest who's an expert in the medical field. We're eager to hear her story. Ladies and gentlemen, please welcome Laguel to the What's Up Aboard Lab today. How are you doing today?
I'm doing really well. Thank you. Thank you
Okay.
for having me.
Oh, glad to have you. Go ahead and you say your name again so I make sure I'm saying it right for those who listen. I want to hear you say it. How do you say it?
It's Laguel.
Laguel. Got that.
Yes.
Laguel. Okay. She's the first Laguel we ever had on the show, so this is already making history.
It's
I
gonna
don't
be
know. I
your
think
last.
okay. Okay, LeGlaw. Tell us about you. In your own words, how would you describe yourself before we get started?
Oh, um, I would say passionate, charismatic, very I'm a devoted person,
Hmm.
and let me think of another adjective. Very driven.
Oh, okay. I like that. So where did you grow up at?
I was born and raised where I still am, Marion, Ohio. I have been here pretty much all my life. I did do a little bit of traveling where I thought I was going to live somewhere else. I went to North Carolina for a small stint, but then I
Mm,
came right back to my roots. I've been here pretty much all my life.
okay. So you're not going nowhere. Now this is it. You planted now,
No,
right?
no, no, no. I was just telling my daughter the other day. I think I've had enough of Marion, Ohio. I am ready to venture out, see different
Mm,
cities, maybe live somewhere else, maybe Columbus area. It's popping and moving around.
okay.
Even Delaware, Ohio would be good because I work in Delaware, so it's a nice little city.
Okay.
So I'm not
So you're gonna
stuck here.
okay, you're not stuck there, but you're not gonna leave Ohio though. You're not gonna like, hey, Florida, California, none of that's out.
Mm, only if I go see my father, and maybe if he gets older and may need me in Georgia where he is,
Okay.
possibly. But he has a wife too, so um, I'm an Ohio person. I love the winters. I love the cold. I like the different
Ooh,
seasons,
oh
and you
my.
can't seem to get that, in South. It's pretty either hot or just chilly. But I love Ohio. I love the weather.
I hate snow. Well, you're wow. Okay.
I
Um,
love snow. What?
you can't housebreak it. I've tried. It just uh, okay, we'll come back to that. So did you grow up with both your parents in the household?
I did until I was about 5, and I was so young, I don't remember us being a family.
Okay.
So my parents divorced. I think I was a 4.5 or 5 years old. So I
Hmm.
grew up in a single parent household.
Okay. All right. Did your dad end up moving out to the South, Georgia after that? I take
Yeah, he's been south as long as I can remember. Like I said, I don't remember us being a family. My mother did have pictures of us together. So I
yeah.
have those as memories of us, Christmas time or whatever. So I can see us together as a family. I just don't have
Mhm.
the memory of it.
Okay. All right. Since you grew up primarily with your mother, would you say you're more like your mother or less like your father?
I'm exactly like my father.
Wow. That's
Exactly.
interesting.
And my dad he was distant when I was very young,
Okay.
and he wanted to get his degree. He's an engineer, he's a plastic engineer. So he went straight into college and got his
Hmm.
degree, and he traveled all over the world in plastics, in plastic engineering. And the little bit of times I would get to see him,
Hmm.
I'm an exact replica. Like I speak like him, I walk like him, I look like him. And it was always so amazing to be in his presence because
Hmm.
it would be
Hmm.
like I see myself. So I'm just like my dad.
Okay. Awesome. So did both your parents get degrees too? Or
Well, my mother, this is what she told me when her and my dad were first married. I don't know if you remember correspondence courses.
yeah, yeah. Uh-huh.
Like you can get something in the mail.
Yep.
And
Hmm.
my dad was always very driven to get an education. And he told her at a very young age, of them being married that was probably going to go south and go to a college. And she wanted to do something with her life too. She was a young mom. I think they were 20 when I was born. And
Yes, that's young.
he paid for her to have this correspondence course in home interiors. And so that's what she did. She got a home interior degree through the mail. And while she was home raising me and my sister, that's what she did. She got her degree in home interiors. So
So she's
they're both educated, but she did an in-home degree, which I thought was pretty fascinating.
yeah, that's like online classes before online, or I guess
Yep, she
on
sure did.
mail.
Just came in the mail. Yep, came in the mail.
Boy, it feels that easy now. Ooh, okay. Uh, what about
You're
brothers
talking
or sisters?
70s, so the 70s,
Oh,
right?
okay. Yeah. You're right.
Yeah.
Because I remember when Phoenix Online came out, everybody's like, oh, nobody want to do a degree online. It'll never go anywhere. Now, look, everybody's online.
Yeah, yeah.
So, mhm. So I was asking you, did you have any brothers or sisters, or are you an only child?
I do. My mom had four girls, so there's four of
Ooh.
us. No brothers, just girls. So when I had a son, it was like it was a course for me because I had never really been around boys. And so
Okay.
when I had him, I was like very nervous, but it's so much easier to have a boy. I'm just going to tell you that right now. He was so much easier than my daughter.
Mm,
But there's four of us. I'm number two in the cycle. I have an older sister and I have two younger than me.
okay. All right.
Yeah,
Four girls total. That's
four
interesting.
girls total, no boys.
Mm, hmm So why do you think it's easier to have a boy versus a girl?
Um, I have to say this, Lindsay was very easy to raise too because she's not an extremely emotional person in general. So
That's a
she
good
didn't give me
thing.
any trouble at all. Um,
Hmm
but my son, he's just so laid back. Like it's like, Mom, it's not that big of a deal. Everything's not that big of a deal. Like we're just simple. He always tells me we're just simple. Like if I'm
hmm
wanting to do something, I'm just doing too much. He'd be like you just doing so much right now. Like, just keep it simple. Never gave me any issues. Never was one of those teenagers that, at least that I know of, that did anything to where I'm like, you need to really straighten it up. But
hmm
just so easy. Never complained about it. Nothing. Just never did. So much
hmm
easier than a girl.
I can
And they
understand.
we come with the relationships and not knowing how to pick boys and all that stuff. That's the drama the girls bring. Like goodness.
Yeah, definitely. I have two daughters, so I understand completely.
Like gosh, you see this dude?
So tell me about
Yeah, but no.
your education. Now, you said your dad and both your parents are educated there, so I'm sure that probably affected you at some point as well. So, what school did you attend for your education, and what field did you select?
I went to all career centers. I selected nursing. I went to my first career center as a junior in high school.
Uh-huh.
My mom was very adamant that we were not going to be in the high school doing nothing, and that was driven from her being a teenage mom, and she
Mm-hmm.
wanted something different for us girls. So she chose the career center for us. We didn't have a choice. She literally drove us out there and said, "Pick something."
Mm-hmm.
And so I chose nursing. What that time it was called a nursing assistant program. I chose that, and I just fell in love with it. And I went back to the same school again and got my licensed practical nursing degree after being a nurse aide for 8 years. I
Mm-hmm.
went back to the same school and got my registered nursing degree after I had been
Mm.
an LPN 18 years. So I chose the nursing field.
Okay, so that was a CNA, LPN, and then RN.
Hmm.
Okay, so you was dedicated on that. You wish you had just got the RN to begin with?
No. And I'll tell you why, because I had so much exposure to, I do geriatric nursing, which is most of long-term care, nursing homes, things like that. I had so
Mm-hmm.
much exposure to that population, being a CNA first,
Mm-hmm.
taught me a lot about bedside nursing, gave me a lot of compassion for people that a lot of off the street nurses don't have. Like if you just graduate from high school, and you go straight into RN
Mm-hmm.
degree. A lot of those nurses, they have no bedside manner.
Oh
They're
yeah.
rude. They don't have any patience with people. And this just showed me a totally different demographic in society is our geriatric population. And it just gave me so much compassion starting out as a nursing assistant, bathing people and just being there, while they're
Mm,
dying at the bedside. And then when I
yes.
became an LPN, I just stayed in the same field because I loved it. I still work part-time in it now. Um,
Oh, okay.
in the geriatric field, but I had an actual patient's family tell me when I was a nursing assistant, you should be a nurse. I had no desire to be a nurse. Um, I loved being a CNA. I loved it. I loved being at the bedside, taking care of people, giving showers, feeding, just being that compassionate person. And it was
Hmm.
somebody's family member that said, "You are so compassionate. Like, you should become a nurse. Have you ever thought about it?" And I thought, I never did
Maybe.
think about it. And they were the one
Hmm.
that pushed me into thinking that maybe I could go into nursing. And I've been doing it ever since.
Now, when you became the second degree, the LPN, what what things did you get to do differently that you weren't doing as the CNA?
I get past medications. Now this was way back then when I graduated. LPNs were not even allowed to hang IVs, even touch IVs. So when I went to school as an LPN, I wasn't even taught IVs. I knew nothing about IVs. But
Hmm.
when I went back in 2010 and got my RN, I had to get my IV certification just to get into the program. Nursing had changed so much. But I could pass medications. I could do things like that. I could give injections. That was different than being a CNA. And a
Hmm.
LPN is a licensed nurse. A
Okay.
CNA is not. It's just a
Okay.
certified nursing assistant. You take a class, you get a certification, but an LPN is a licensed nurse. So you have a license. You have to sit for a licensure exam. So that was the difference.
Okay. And then why did you decide to go for the RN after that? You did that for so long. What made you say, you know what, I don't do this? Was it the money? Was it just the clout, the status? What was it?
It was definitely the money because at that time
Okay.
I was going through a
Yeah.
divorce from my husband, and I knew I couldn't take care of my two children on my own on just my LPN salary.
Oh, wow.
And he had made quite a bit of money. He was always a maintenance guy. Always made really good money. He could put like air conditioners and stuff in. So he was a trade
Okay.
person, really
Yes.
good
Yeah.
with trades. Never set foot in a college, just all knowledge. And I knew once I separated from him, there was just no way I could take care of me and my two children.
Hmm.
And so I thought, you know what? I really just need to go back and get my nursing degree because that set me in a huge higher bracket for money. I think my income went up $15 on the hour when I went from LPN to RN. And that was 10 years
Man.
ago. That was pre-COVID. So I knew it then. I had to sit down and just say, okay, what are you going to do? Because this relationship surely isn't working.
Hmm.
And I had to be honest with myself. Like, you're going to have to go back to school. And it was the hardest thing ever because I did it. We were still living together, still married, separated in mind, right?
Right.
Going through the divorce, going to nursing school, raising my two children. It was the hardest thing I've ever done.
Yeah, that's
It
a
was
lot.
so hard. It was hard, very hard. But
Yeah.
I thought,
So,
you can't give up, girl. You need this money.
right. That
So
motivation to make you do
that's
some
what
stuff.
pushed me. Yeah, my children.
Yep. So, how long did you have to go to school since you already had the LP, and how much more time was involved with the RN from this point?
Actually, since I stayed at the same school, it was just a year and
Oh,
maybe 14 months
oh,
because I
that's
did like
amazing.
the stair step program.
Hmm.
So we went to class 3 days a week and we had 2 days of 12-hour clinicals. And
Ooh.
so I did the accelerated program.
So,
And
were
it
you
was
working
like,
another job? So, you working still while you were doing that?
I sure
How did
was.
you do
On
it?
the down low, I was working night shift. But there's one of the one things they told you, you are not allowed to work nights while you're in class. But a lot of nurses had to, like, not everybody had a husband at home, or like people just can't
Hmm.
stop working because of school.
Right.
So I was working night shift at
How,
a local
how did
nursing
you
home.
how did you
It was
juggle that
crazy.
working nights and
It's
then
crazy.
were you sleeping at work or something?
Let me
You
tell you, I
had to
was doing a
go.
lot of stuff. Probably
Okay,
was.
we ain't gonna talk about that then.
I was also doing my work at work, my classwork.
Hmm.
So there's a lot of downtime on night shift. So
Yes.
it's not as busy as a day shift, right? There's a lot of downtime. Like when you get your meds done and people are sleeping, they're in bed. So you have a lot of time. I did all my schoolwork at work. I was very
Hmm.
sleep deprived for about a year. Sleep deprived,
Really?
tired, grumpy, probably. I'll have to ask my kids. Very grumpy, just like, but I had to do it. Like, it just
Hmm.
motivated me to stick it out.
Yeah. Well, I guess since you had kids, that kind of prepared you with that sleep deprivation because we know how little kids are when they're what them 3, 4, 5, 6 months. We know how that can go. You might not get
Hmm.
no sleep at all. So you were prepared for that.
Yeah, it was detriment. It was terrible, but I did it. So it was the
Yeah,
money that
yeah.
motivated me. So
Oh, okay, okay. So are you done with school now? Or is that behind you now, or are you a lifelong learner? We're gonna go back and get that nurse
I am a
practitioner.
lifelong learner. I'm a lifelong because now I'm working. We had talked about that earlier, working at the Career Center, and it's high school seniors, and you have to have a teaching license. So now I'm doing that online with Bowling Green State University
Okay,
and
yeah,
teaching
good
all
school.
day long, Monday through Friday. And I'm getting my career tech education degree through Bowling Green. So here I am again, back in school,
Back at it again. Look at there. Yeah,
back
so
at it
so
again.
and you said that degree you're getting now is a career tech degree.
A career tech education degree. Yep.
Okay. And what will that entail when you get that degree? What does that actually do, the career tech?
What I've been told about it is it was created post COVID. So before then, I think it was like a 4 year degree. You had to literally have the degree before you went into the teaching, before
Mm-hmm.
you went, even step foot in the school. This is post COVID. It was created and it was expedited to like 24 credit units. That's all you need because
Mm-hmm.
they need teachers in the classroom. So they
Right.
just took people who were experts in their field. Since I've been a nurse as long as I can remember, they consider me an expert and they put me in a classroom and I'm allowed to teach while I get my teaching degree. So this
Amazing.
will give me a teaching degree in career tech education, which is pretty much career centers across the
Okay.
nation. Yeah.
Hmm. So you're teaching without the teacher's license. So
Hmm.
how did you even know about that position? How did that come about?
I just came up on it. I was working at Columbus State, teaching the same program I teach now, but I was teaching adults, and I was an adjunct there for 2 years. And they were doing away with, well, you could still be an adjunct, but I really needed a full time position. And they're like, we don't have any full time right now. We only have adjunct. And I'm like, I have to have a full time position. So I just started surfing, internet, job sites, things like that, looking for teaching because I still wanted to teach, not knowing I was going to need a degree when I got into high school.
Hmm.
But I knew I had that teaching degree on an adult level.
Okay.
And they called me back. I applied to Delaware Career Center. They called me back and they kind of ran through it in the interview. Like, if we hire you, this is what you're going to have to do. It's like, you know how you run out something really quick. I'm like, oh,
Hmm.
okay.
Yeah, yeah,
And then when I
yeah.
got hired, it's kind of like, hey, you remember that? I'm like, what? So that's how I looked up on it, just applying for the job and getting the job. And it's
Mm.
standards of Ohio. Every state has them, but it's Ohio State standards of what teachers have to have if you're in the classroom for minors. That's the difference. I went from adult to minors. And, they
Okay.
have all these rules, government, local, state. So you have to be in line with all those things. So that's how I ran up on that.
Mm. Now, was there anybody else who kind of got in this position with you, or you the one of the few doing this? Is this like a
No,
something?
it's actually something that's across the state. So I was hired with three other people
Okay.
for different positions in the Career Center. We all have to get our teaching license. So we're all taking classes at the same time
Hmm.
for any new teacher. And like I said, this is all post COVID. It's just to keep teachers relevant and to keep them in
Uh-huh.
the classrooms.
Yes.
And I think it's brilliant the way they came up with it because you're already expert on what you're teaching from just
Hmm.
your experience. Because I've had so much experience doing it. Um, but then you need to learn what it means to actually be a teacher.
Hmm.
So it's a two-way street here. So I think it's pretty brilliant the way they came up with it.
Yeah. So I take it you're pretty smart then, since you have all these degrees and going back to school. I mean, and then you can
Um,
bounce it all together, and just
a
naturally
little, I
gifted.
guess.
Okay, all right, yeah, you're modest. Okay, all right,
I mean, I guess. I'll just say I know a couple things. I'll put it that way. I know a couple
okay.
things.
No, a couple things about a couple things. Okay.
But if you take
Um,
me out of nursing, I have no other skills.
well, that's a good skill to have because it's definitely in demand. And I know they had a nursing shortage for a while here. I wasn't sure, was that nursing shortage due to not having enough educators, or was it just there were that many positions that they're popping up?
There are so many positions for nurses, and also the nursing to patient ratio is out of control. And that's why they have such a
Oh,
short nursing shortage. Like nurses go to school and they see the money, they see the paychecks. Oh, this is awesome. But they get into the actual field and realize it's a very exhausting job. You
mm-hmm,
barely get a bathroom break. The demand from the doctors, people just being around all types of social workers, physical therapists, like you're bombarded with, you work with every single department in the hospital. You're not just by yourself. So you
mm-hmm.
think about dietary. Dietary works pretty much with dietary, but nurses have to be aware of diets. And so they work with dietitians, they work with everybody. It's such a demanding job. It's very exhausting. You're on your feet a lot, and a lot of nurses don't understand that. They just think it's putting a stethoscope around their neck, wearing a cute
Mm-hmm.
uniform. Then they get in there and thinking, wow, this is hard work. Yeah, it is hard work. And so
Yeah,
nurses feel like they should be paid more. They feel like they should only have so many patients.
yeah,
Why walk, you work on a floor and you have like 20 patients to one nurse and you have one nursing assistant. So it's just crazy what nurses have to go through. And a lot of people are leaving the field.
really.
Yeah, once
That's
they got into it and said, this is crazy. I'm not doing this. Yeah.
that's kind of hard. That's kind of hard. It's kind of like to me, it's like education because once you get that certification or that degree, you're kind of like monolithically you're aligned there. So if you leave, you gotta go back to school or something, right? Because you can't just. I mean, wow, tough call. Plus all
Very
that
tough
money.
call. Yeah. Oh,
Yeah.
yeah. I mean, they've made really good. Here's the thing, they almost put them in a position to make the choice. If you're sleep
Mm-hmm.
deprived, you're tired, and you can't make sound decisions,
Oh yeah.
when you've worked four 16-hour shifts in a row and you have children at home and you have a husband, and you know what I'm saying, like it just puts so much demand on you. Like it's called nursing burnout, and they've
Oh
chosen to just say, you know what, it's just, this ain't doing it for me, so they go back to whatever they were doing before they got the
mm,
degrees.
yeah.
Yeah.
I did some research on that. Forget that first African American lady, the nurse. She was I don't know her name. I can look it up, but I heard she got in the field and she didn't like it because of this was what the 1800s, 1900s, or whatever it was. I don't know what year really. And she went away from it because it was too demanding for her. In addition with all the other things that came along with it. So I guess burnout is real. I didn't until you said that. I really didn't consider the all the things you had to do, like you said, the dietary, this person coming in, the families. That is a lot. It's a
It's very
whole lot.
taxing on you, and then families have this ideal that you're God, especially if it's somebody that's dying. It's like, why can't you save this person? Why can't you? And having that on your mind all the time and the demands that they put on you. And not talk about the people you supervise. Not only do you take care of patients, you supervise nursing assistants. So you're also supervisors. Then you have somebody
Mm-hmm.
on your head, then you're being talked about and then you're being looked at your job. It's probably the hardest job. It's very rewarding
Yeah.
if you're fortunate enough to do something like I do, because I've always done geriatric nursing. I knew I wanted to do it all my life. It's very rewarding, but it's very hard on you. It really is. Like you have to have a gift for it, I feel like, to do it as
Mm-hmm.
long as I've done it.
Yes. Now, just to be clear, when you say the geriatric, does that mean older individuals?
That's the older population. 65 and older is what's considered geriatric. Yeah.
Okay. So, do I'm not sure if the older population is any different than, say, someone on the regular floor. Do they require more attention or more time or something, or what's one of the challenges you face with a geriatric patient versus, say, a traditional patient?
I think the geriatric patients, they give you more of a routine
Okay.
than like a hospital patient. because in the hospital, you have what we consider acute patients, like they're there for a short amount of time.
Mm.
Geriatric nursing is like a nursing home. Patients are there to live unless they have like a skilled nursing facility is what I work in. I work all over the facility because I can work in a unit that has hospital patients. Let's just say you broke your hip, so to speak, and you went to a
Hmm.
hospital. You can only stay in the hospital for so long,
Right.
but you're too young to go to a nursing home and live, but you need some type of rehab. So you would probably end up in a skilled nursing facility, which means you have nurses there that can do like IV therapy and things like that. But on the other end of the building is a nursing home. That's what I work in. So you
Okay.
have your acute care patients, people who have been pretty much kicked out of the hospital because insurance has given up on them, but you still need to
Mm.
have 24-hour care. So you'll end up in somewhere like that. So the
Mm.
difference is the turnover. Hospitals, you may go see somebody in the hospital today and you go back and like, man, I just, they're home already. But with the nursing home, you get to build relationships. And that to me was more fitting for my personality. You got to build the relationships, they become like your family. I'm a very routine person.
Hmm.
And for me, that fit. I really liked having that. And they become your family. So that's the difference.
Yeah, I can see that. So you picked two professions that I did the sub teaching for a while back when I was in college, and I know that was challenging. So if you said didn't
Mm.
get nursing burnout, if you're doing education, that piece of it too, you're like in a perfect storm there. How is it teaching these people you work with? Is it challenging, or do the young people want to work with you, or how is it from your perspective?
I'll put it to you this way. The kids are willing. It's just all of the red tape surrounding education from K to 12. It's
Mm.
all the bureaucracy. It's all the red tape. It's all the mumbo jumbo, all the stuff added. The students are willing. They're typical teenagers. They got their attitudes and stuff like that. And I've raised teenagers. So I told them from day one, I'm built for this. So like
Bring it.
don't come at me. I'm built for this. So I'm the wrong one, right? I tell them first day. Like I have
Uh-huh.
expectations out of you. But it's everything else, the demands of the state, the local government, the federal government. That's the things, all their expectations and demands. That's what makes the job hard. The teaching
Okay.
part is easy.
Okay. That's good to know. Um,
Yeah.
I, so I wanted to ask you this as well. I've heard the stories about the test that you had to take to become a nurse. I think it's called the NCLEX test.
Hmm.
Do you remember that?
Oh, oh yeah. I remember the NCLEX. It's a nightmare.
Yeah. How do you prepare for something like that? Is that something you help your students to prepare for as well?
My students don't have to take the NCLEX because they're
Okay.
state tested. They do have to sit for an exam. It is a comprehensive exam. They actually take a written portion and a skills portion where they have to show a certain skill.
Hmm.
Um, Way different than the NCLEX. um, but we do prepare them for the testing. What you really much have to do is you have to teach your students how to answer questions. Like
Mm.
they have to learn how to answer the content that the test wants you to know. And it's all critical thinking. So it's you have to think outside the box. The NCLEX is a perfect world. I tell nursing students this all the time. I could never go into the NCLEX and answer it based off of my experience because I would fail it. It's a perfect world. You always have the doctor, you always have what you need. And so when you go into it, it's textbook, 100% whatever the textbook says. So you can't even take your clinical experience into the NCLEX and pass it. Because in your clinical experience, you see people bending corners, so you seeing people,
Right.
doing what they need to do.
Right.
Um, of course, within the law, but you can't think, you have to literally turn off your brain and put yourself in the NCLEX world. It's a perfect world. You always have all the supplies you need. The doctor's already written the notes. And once you understand the test, I
Hmm.
have perfect A students in my nursing class fail the NCLEX.
Really?
So it has nothing to do with intellect at all.
Yeah. Yeah. So it's just more like rote learning. You just gotta.
You need to know what you have to critically think. They're
Okay.
not going to say to you, is this a blood pressure pill? They're going to give you a scenario about a situation with a patient, and you're going to need to know out of that scenario, oh, they need a blood pressure pill.
Mm-hmm.
They're not going to say, hey, this is levothyroxine. This is for your kidney. I mean, this is for your thyroid. What they're going to do is they're going to give you a scenario of different things that have to do with your patient to where you say, I think this is a thyroid problem. And then you
Mm-hmm.
pick levothyroxine. So it's like that. You have to critically think. They're not going to give you the answers. It's different in
Critical
school.
thinking. Yeah.
Yeah. You just learn drugs and you pick the drugs out of your questions. Oh, I know this is a blood pressure pill. That's not the NCLEX. You have to critically think.
Man, I know I wouldn't pass it then. So sounds like you got to know all those meds. I guess you get that in core A and core B, but still, that's a lot. I mean, it's a lot of meds out there. So I
Mm-hmm.
guess are they in classifications or something like that? Because you
Yeah,
said
if
that
you
they're
if you have
progressive.
any nurses listening, this would be my question. This would be my help to them if you have nursing students listening to this. Classify your medications. You can never learn all those meds. Even pharmacists don't know all the meds, but you put your meds in classifications. All blood pressure pills have the same side effects. I don't care what the name of the blood pressure pill is. They
Hmm.
all have the same side effects. If you learn the drugs and you classify them correctly, you can pick them up out of a question every single time. But it's
Okay.
trying to learn the name of the drug. And but no, if you know if it's a blood pressure pill, it goes in this classification, and you know what the side effects are, you'll pick it out every single time. You won't miss it. So you have to
Hmm.
simplify your mind when you're taking the NCLEX.
I see. So did you
Mm-hmm.
know all this going on or going in there, or somebody kind of prepped you, or did how many times did
Nope,
it
I
take you to
flunked it the
pass it?
first time. When I took my LPN,
Okay.
I flunked it the first time.
Okay. So then you kind of learn. Okay, now I see I gotta. I see. Okay, that's
I
what you
flunked
learn.
it because our school didn't prepare us.
Mm-hmm.
They didn't give us NCLEX style questions. Like you have to prepare your student. So when the first time they sit down, you're not like, I actually raised my hand because you're not allowed to move around in there very much. I raised my hand so the proctor could come over to me. I said, um, I'm here to take the NCLEX because I literally didn't know what was going on. And she said, this
Mm-hmm.
is the NCLEX. I'm like, oh my gosh. I
You
was
knew
not
then.
prepared.
Yeah. Yeah. How much is an NCLEX exam?
I think it's $200 now.
200 a pop?
$200, $200.
And then they reimburse you once you pass it?
No, they don't
That's
reimburse
just,
you. You out of
oh,
your money.
oh no, no.
You have to fill out an
Wow.
application. Your application is $75. That's just to take the exam. And then when you go
What?
to the exam, you have to pay the testing center. That's Pearson View. It costs you $200. Every time you fail it, you have to retake it. I went to school with students who took the NCLEX 5 times, 6 times, 7 times. And in Ohio, you can retake it every 45 days.
Oh, it's a long time to wait.
It is
Wonder what
45 days you can retake it, but you still have to pay your $275 because you got to fill out another application for 75. It's $200 to go to the testing center. It's very expensive. It's all about money.
oh yeah, I clearly see that because man, you would think that
Very
well,
expensive.
I guess they want to get the best of the best of the best, I guess, if they're coming in with all those I call them weed out
Oh, they
options
weed
there.
them out. That's for sure. They weed you out because you have to be a safe practitioner. They're just trying to see if are you a safe nurse, and they figure it
Mm-hmm.
out by that test. It's like a computerized, like adaptive test.
Mm-hmm.
It's not a normal like if you've had college. It's not a normal like multiple choice. It's a
Mm-hmm.
computer adaptive test. It bases your questions off how you answer the first one. So if you answer it a certain way, it'll give you another question based off how you answered the one before.
Ooh, so if you
It
miss
reads
one or
you.
two, yeah, so it said you missed out. She kind of missed this one. Let me just hit her on five more of those.
Yeah,
So the
and what
best
it'll
thing,
do is it'll either give you a harder one to say, okay,
what?
she really don't know what's going on. Like it almost tricks you. So it'll give you a harder one. If you get the harder one, then it'll give you an easier one. So it reads you the way you take the test. And
I
then when
would
you
be
get to a
scared.
certain number, it determines whether you're safe or not, and you either pass or you fail.
I would be very nervous knowing that going in. That would be nervous because it's like because
Yeah.
you probably got second guess. If I've never taken the test, obviously, but I'm thinking it's probably going to give you four answers that seem like the right answer.
They're all the right answer. You're like, man, all of these are right.
Yeah, man, like he lived, so he's good.
Yeah, you have to
Okay.
narrow it down. They're all right, but which one is most right? I can't stand that. Which one is most right? And that's the
Mm,
one you pick. So
wow, that's interesting. Let me ask you this: do you get in your class? Do you have a lot of males that are taking these classes too, or is it primarily
you know
female?
what? This year I actually have two male students. Last year I only had one. I was glad to see I had two this year. Nursing is still predominantly female. It just
Mm.
is. You do see a lot of guys coming in now, and I think it's great. But they're discriminated against not only by patients but also by nurses.
Why do you say that? Why are they discriminated against?
Um, because of the gender. Like a lot of nurses don't feel like men should be in nursing. And men, when we
Really?
go to our nursing homes, a lot of the older women don't want the men taking care of them.
That's
Mm-mm.
interestingly odd.
A lot of
I
the
mean,
older women, they're like, especially if they've been married to one man for a long time,
hmm
they look at that as this is my husband's body. I don't care if they're a widow. They could be a widow. And they're just
hmm
very old fashioned. Like, I don't want them touching me, looking at me. They may allow them to give them medication, but if they have to do any type of exam,
So
they
what
don't
do
want
the
the
males?
men.
What do the men do in that situation then? I mean, you have to earn a living. Then do they? You don't lose employment, do you? If people keep pushing you away.
No, they just they struggle. They
Hmm.
struggle. Most of them stay in hospitals to where the population coming in the hospital to be cared for is younger,
Uh-huh.
so that
Okay.
they've learned how to finagle the system. They don't go work in nursing homes where you see an older population. They've just
hmm
learned they don't accept me here.
hmm
So they stay where maybe like emergencies rooms, you'll see a lot of men.
Oh yeah.
Um, yeah, you see a lot of men in emergency rooms. You'll see them on the floor in the hospital working because the population is much younger coming in
hmm
there. So, or you may see
Yeah.
them working pediatrics because it's children. So you'll see a lot of male nurses there. So they've just had to learn their way around the system. It's unfortunate.
hmm I remember back in the days, the healthcare field really wouldn't let you wear tattoos or pink spiked hair. Has that changed a
Oh
little,
gosh.
or are
You
they
see my
still the same?
braids? Yeah, it's changed a lot.
So they're okay with that now. They can, yeah.
It depends on where you work. Like you can't be outlandish. Like in our place, you have to cover up tattoos. You're allowed to have them, but you have to cover them up. Like you have to wear a
Mm,
sleeve over them. If it's anything outlandish, they still have dress codes.
Mm-hmm.
So you're still there to do a job. So you can't be crazy with the piercings and all that stuff. But they also can't discriminate against people. So what they've done is come up with dress codes like your piercings can't be visible. Like you can have one ear pierced, but you can't have 25 piercings on one ear
Mm-hmm.
and nose rings hanging out and lip, you have to take them out. So
Oh,
they've
so they
had
can't
to
do that.
really be careful there. But yeah, we
Mm-hmm.
see all nurses doing all kinds of stuff. I mean, we wear nails and everything now. And before, when
Mm.
I was in nursing school, you was not allowed to have your nails past your like the padding.
Mm-hmm.
Oh, now
Now it's free for all.
carte blanche.
But
Yeah, free
yeah,
for all.
so is your facility not tattoo friendly, but some most of them are then because people are getting sleeves left
Um,
and right now.
I think that it depends on who they are. For us, I don't see a lot of tattoos in the building, but I do know there are some girls that have them. They're very minimal, very minor, but I've worked with nurses that have the sleeves and everything.
Mm-hmm. Okay.
Yeah.
Yes, it's popular, and that's people make good money tattooing too. I worked with a young
Hmm.
lady. She had a long tattoo from head to toe. I said, "How much is that?" She said, $1,000. I was like, "Oh no, 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 no." I mean, but hey, not gonna hustle. Um, I want to ask you this as well. I went to school with a lot of people who ended up becoming nurses. Do you think anybody can become a nurse as long as you can just pass that NCLEX? Anybody can do this?
I do. I feel
Okay.
like anybody could pass the standardized test. I do. I feel that they could. I've worked with some nurses who have passed the test, and I'm shocked
I
because
know
they
I
seem
am.
like they seem like they have no common sense. But
Mm.
the test, once you master how to pass it, you can. Did you hear about that? It was on the news a couple of months ago about that nursing school that was faking nurses into getting
Yeah,
licenses. Like they were doing
yeah,
that, and they were
I've heard
sitting
it.
for that exam. A lot of them
Hmm.
nurses had sat for that exam and had not had one class. So you can
Yeah,
pass it if you know how to pass it.
right. Oh, that's
Anybody can do
scary.
it, but not everybody should. There are so many
Right.
nurses that are mean, they're hateful, they're nasty. You're looking at them like, why did you even become a nurse?
For the money.
They always got an attitude.
Hmm.
You know what I'm saying? They talk to patients and families crazy. I'm like, so I
Yeah.
think anybody can do it. I just don't think everybody should.
What do you describe what you consider to be a good nurse? What would be an ideal nurse?
I think, first of all, a nurse should be somebody who truly wants to take care of people, regardless
Hmm.
of the diagnosis.
Hmm.
You need to have a heart for illness. You can't get into nursing unless you're taking care of sick people. So you
Hmm.
need to have a heart for people who are sick, whether it be somebody whose blood pressure is out of control. It could be somebody who just maybe slipped and maybe broke their hip, or they're not
Hmm.
well because they need help. So I think you should have a heart for the sick. You definitely need compassion because it takes compassion to take care of somebody at their lowest.
Yes, I agree.
To have somebody wiping your private area and you've been a military soldier all your life and you've been a man, you've taken care of your family, you need to
Hmm.
have compassion for that person and see that person that, hey, he's raised a family, he has children, he's just down on his luck. And so you need to have compassion so people can be vulnerable with you, so you can get the job done.
Hmm.
And you definitely have to have diligence. You have to be able to say, listen, we work 365 days a year. Ain't no such thing as a holiday we don't work.
Yeah,
We
that's
don't
true.
get summers off. We get the most worst vacation I've ever seen. You get your 7 days off. We work long hours. Like you have to be ready to do it. You need to really research what does it mean to be a nurse?
Hmm.
Because it's not all fluffy and it's not all about paychecks. Because like I said, some people walk away from that money quick because it's a very hard job.
Yeah.
That's what I feel like it takes to be a nurse.
Okay, good answer. Do you is that stress to the students that what you just said of the gravity of, hey, this is real life here, it's like ongoing. Is that stress to them? Are they aware of that?
Sometimes,
Okay.
sometimes, but I have had my students tell me because I'm upfront with them, it makes them feel better because these are nursing assistant students. And I
Hmm.
tell them it's the worst job. Nobody ever tells you thank you. Like it is the one job nobody wants to do. But if you
Hmm.
can do it well, you will have respect of your nurses. You will have respect of the people you take care of. You have
Yes.
to do this because you love it. Because
Hmm.
if you don't love people, you're gonna hate the job because it is the one job that people are like, oh yeah, thanks for last week. Like you never get a thank you,
Hmm.
but it's the hardest job. To shower
Yes.
people, feed people, take care of people when they've lost control of their bowels and bladder and things like that. It is a hard job. It's
Yeah.
a messy job.
Hmm.
And so if your heart is not in it, I tell them from day one, if your heart's not in it to do this, I'm gonna tell you this right now, you're not gonna last.
Yeah.
Yeah, your heart has to be in it.
Well, I want to talk to you about that, but a little more too about racism in there. It's a quote I got here I want to read with you. It says,
Okay.
across the United States, white citizens are experiencing an awakening, recognizing that systemic racism that bleeds into every fabric of life, from housing and grocery shopping to education and earning an income and affecting Black, Indigenous, and people of color. The nursing profession is part of that awakening. Do you find that uh, you've seen racism on your end, and who's it coming from, if it's affected you at all?
I'll have to say I never was looking for it.
Hmm.
So in our family growing up, I had a very proud grandfather, black man, worked in the steel mill all of his life.
Okay.
Um, we weren't allowed to say certain words in the house when we went to my grandfather's house, right? Um,
Yes.
he didn't really talk much about racism. Like we knew it existed because we read about it in our textbooks and things like that, but it was never really talked about in our household. So I didn't grow up as an adult looking for it, if that makes sense.
Okay.
So even in my field, I don't want to say too much as racism, but I was always the only black in my class when it came to nursing. I was always the only black graduate.
Mm-hmm.
I've worked in places where I've been the only black employee, but I haven't faced lots of racism on a job. Every
Okay.
once in a while, I'll come across a coworker that you can feel they got a problem with you,
Mm-hmm.
but from just the way you come across, I did work with one girl who refused to recognize me as an RN. She
Wow.
refused to recognize me as one. Um, she would even speak to other people and say that nurse. Another business, like she's a registered nurse. And when she would even have to come get me, like if I was a supervisor, she was an LPN.
Mm.
She would try to do it on her own because I was her supervisor.
Mm-hmm.
She didn't want to recognize me as an RN, and I knew what it was. And I've come across some racism when I take care of older, I'm saying 90, probably 90-year
Yeah.
old white men who
Uh-huh.
have no problem telling me they have a problem with me. But it hasn't
Wow.
been overall to where I want to get out of nursing. I've never really faced it on the job to where I've never had a supervisor feel that way about me. If I
Mm-hmm.
did, they've never said it. And
Yeah.
where I work at now, it is the most inclusive place I've ever worked. It's one of the nicest places I've ever worked, Delaware Career Center, and not one time there. But when I worked at a facility,
Yes.
you know, she just refused to recognize me. And I thought,
Yeah.
regardless whether you recognize me or not, I'm still an RN. So
That's right. Yeah. They got the badge to show it. So yeah. That's unfortunate that
yeah,
people
she just
think like
refused.
that. In 2023, 2024, people still thinking like that. That's just
Hmm.
yeah. So I guess we all have to grow. We got some things there. I remember Serena Williams had went to the hospital a couple of years ago, and she was having some issues, and she had complained that she wasn't getting the treatment she deserved and so forth. So I remember asking the physician about that, and he said that there's some things on the trainings that need to be updated because they thought maybe certain cultures could endure pain better than others,
Mm,
or maybe they really didn't need certain meds and different things like that. Do you find that the curriculum that you teach now is more realistic and modern in what you're telling people?
I do because we have to change with the times.
Yeah.
I think it's very modern. I think I'm just very forthright with the students about this is what you need to expect. But, we do a lot of job shadowing, we do a lot of volunteering. I take them to different places like they're going to be doing some volunteering at the free clinic downtown Delaware, Ohio, to where all types of people come in for free healthcare. The
Uh-huh.
indigenous population, a huge Hispanic population, people who are homeless. Like I'm exposing them to everything because I want them to know, do you really want to do healthcare? Because you're going to be exposed to everybody. It's not just
Mm-hmm.
the ritzy jobs at a hospital. We're going to do some internships at Turning Point, the
Mm-hmm.
woman's battered shelter, battered woman shelter for women and children. So I'm
Yeah.
exposing them to everything that's out there. It's not just working in a hospital, and I want them to be aware of that, and that way they can make their own decision. Maybe this
Yes.
is for me, maybe it's not for me,
Mm-hmm.
but I want them to be well informed.
Okay. Now I know police officers have to take like a psychological test. Is that something that's required for nurses as well?
No,
Or just come in. If you can
no, we
pass
don't
the
take a
test, you can do it.
psychological. We
Okay.
need one.
I was
We
thinking,
need
yeah,
psychological.
yeah, you're dealing with a lot of people's lives there. And I can only imagine what it was like during COVID when people couldn't see their families and so forth. I'm sure they were probably frustrated. They would take it out on whoever represented the company, is what I'm thinking. Was that a crazy time for you guys?
Oh my gosh. Nurses need psychological testing. They need stress management. COVID, I worked during COVID. I worked on an actual COVID unit. I also
Mm-hmm.
made the most money in my life during COVID because I wasn't afraid to work with the COVID patients because being a nurse for so long, I know PPE works.
Mm-hmm.
I'm going to go on the record and say this probably better than the actual vaccine. PPE works.
Oh yeah.
If you wear
What
your
did you?
mask properly
That's
in
a
an
mask. Yeah.
actual COVID, I worked on a unit, and so we had to wear the N95s. They work.
Hmm.
I never got
Yep.
COVID one time.
I didn't either. So yeah, I wore the N95 as well. So you would see they didn't recommend. So at first everybody just having this little blue mask. I said I'm gonna get this N95. It seems
The
like the best
N95s
thing.
work, and I'll tell you, I've had COVID. I'm gonna tell you this: I've had it 3 times, but it was
Mm.
never on a unit where I worked with total. People were dying all around me. People had full blown COVID.
Hmm.
Never got it once. The only time, every single time I got it was with contact face to face.
Hmm.
I got it from somebody who had it, and we were sitting close by. They
Okay.
didn't know they had it, and I got it from them. They ended up having it. That's how I got it every single time. Close contact.
Hmm.
When
Yeah.
I worked on the COVID unit and I wore my COVID suit, like my astronaut suit, and I wore my N95 and I had my PPE on, I never got it one time.
So that's all you had on was the little suit and then we did a shield and a mask. Is that what you wore
We had to
too?
wear it
Okay.
all. Very
Okay.
hot, sweaty, but you had to wear. I
Mm.
never got it one time there. And I tell people all the time, a lot of nurses didn't want to work on COVID units. I made mad money during the pandemic. I can't. Oh my gosh. Oh my
Man.
gosh. I probably made close to 6 figures working on the
Ooh.
pandemic,
Oh my gosh. That
but I
that
wasn't
is
afraid.
nice.
I'm like, I'll
Mhm.
work.
That's what I was wondering. I think I would have been a little nervous because I didn't know what COVID was. I was, you heard so many stories, people dying, and I know it affect older people, younger people. It was a lot. It was overwhelming. So yeah, I'm glad you
Well,
were
when you
able to
work
get in
around
there.
communicable diseases, you have to use your mind. Like we know PPE works. The nurses know PPE works
Hmm.
because we wear it all the time. If you come across somebody that's to say they have, I don't know, somebody has chicken pox, okay, and you've
Hmm.
never had chicken pox, you're not supposed to take care of that person. But if you wear your mask and it's contact and you put it
Yes.
in there, like you're more than likely not going to get it. We know that
Hmm.
already. So I'm
Yes.
like, people doing a lot of tripping.
Hmm.
Just put on your PPE.
Yeah.
And I made money. I know nurses
Hmm.
that made $200,000 during COVID,
Wow. Yeah. That sounds like they're
just
traveling nurse
signing
money
up for
too.
shifts.
Hmm.
Mm-hmm. Sign up for
Yep.
shifts.
Yeah.
Yeah, so I
Can you
worked around it.
what's a typical day like for you now in your work? How does just kind of outline it for me? What's a typical day for you?
Now in the school system,
Yeah, yeah.
I don't start work until 9:45. I drive to work. I live about 30 minutes from my job. So I
Okay.
get up and I drive to work. I have a non-traditional class. It's after school, so I don't have to be there as early as the other nurses. I mean, as early as the other teachers. It's called a flexible learning class. So they flex time. They come after school. So during the day, I do like study halls. I do a lot of training, like for my Bowling Green class or whatever, pretty much just on my own during the day. And then when my class comes in, I teach. Then I
Hmm.
drive home. So I have a pretty laid back day. Um,
Yeah.
Putting my lesson plans together, getting my skills lab ready for students, and things like that. That's what I do before my students get in.
Hmm. Okay. That's a pretty good day there. I like that. Start, you don't have to
Hmm.
fight that traffic getting in. So okay, that's cool.
No, it's pretty
Um,
simple in the morning. Now, when you're going home on 23, sometimes you might get caught up in some traffic, but 40 minutes tops takes me to get home. Not a big deal at
okay.
all.
Yeah. Okay. I have one last question in this round before we go to this second section. So for those
Okay.
who really don't know, what what does a doctor do that the nurse doesn't do? What's really the line of demarcation there? What is because nurses seem to do a lot.
You see, I got my lips together, don't you?
I'm just curious.
um, I can tell you, doctors prescribe medications.
Okay.
They come in, they do rounds. So they actually do, like we do assessments on patients. We listen to bowel sounds and breath sounds. We listen to their heart. Doctors just take it a step further. Like they can hear things nurses can't hear. They can actually diagnose people. They can, prescribe medication for you. They can do rounds and things like that. I have nothing against doctors. I have a great doctor. I love my doctor. But I'm gonna tell you, I'm for nurses. They're rock stars in my book. We
Hmm.
need our doctors, you know what I'm saying? They diagnose diseases and treat diseases and things like that. Way more schooling. I think it takes like an 8-year degree just to become a medical doctor. And then if you do a
I think so.
specialty, you
Yeah.
still have to add like 4 or 5 more years. So they
Mm,
have a lot more schooling. Yeah.
okay.
Not against my doctors. I'm just saying nurses
Yeah,
are
yeah,
they're rock stars to me.
yeah, yeah. I know what you're saying. Yeah, the nurses are putting in their work because I I was a financial counselor at the hospital once, and a nurse and a doctor were having a discussion. And the doctor, I think he was prescribing some medicine, and I think the nurse had kind of subtly said, "Hey, maybe you want to, run that for interaction, make sure that's okay." She did it in a very uh, tactful way. But I know sometimes the nurses seem to know quite a bit. So I mean, I'm not
Yeah, because
taking
we
away
spend
nothing
more
from the
time with the
doctor.
patients.
That's what I
Yeah,
was
we
thinking.
spend more
Yeah.
time with them. And doctors will listen to you. You know your patients, you're with them every day. So they will.
Hmm.
Like we make suggestions for them all the time. Like they didn't seem to do that good on that medication. How about we try this one? So we have to do a lot
Hmm.
of research. We have to know what we're talking about in order to call
Yes.
doctors and say that. Some of them will
Hmm.
take it from you very nicely and some of them won't.
Yeah, I can
Some
understand
of them will
that.
let you
That's
know
what
you're
I'm saying.
stepping over your boundary.
Right. Yeah, that's what. So it's gotta take a strong, confident person to make that call and advocate for that patient, and that's important. That's very important.
Yes, it
Okay.
is.
All right. Well, again, you're listening to What's Up with Ward TV, and we're talking to Laguel today. And we're going to move to one of my favorite parts of the show before we get out of here. It's called Rapid Fire Getting to Know You. I'm just going to ask you a few quick questions, and then we're going to wrap it up. Okay.
Thank you. All
First,
right, let's go.
all right, let's do it. First question is, what type of music do you enjoy most? What do you like listening to? Some Barry
80s,
Manilow?
90s.
Okay. Yeah, 80s,
80s,
90s.
90s, Michael Jackson, Prince, Whitney Houston, Luther Vandross, stuff like that. Any of the 90s bands, Justin
Hmm.
Timberlake. Yeah, that's where I'm at.
Okay. Now, when you said Luther, was that Big Luther or Skinny Luther? Because that was two different types of music there.
All the way obese Luther.
Definitely did.
That's when he had his nice voice.
Yeah, he was serious then because you the
Yeah, big
ooh.
Luther. Yeah, that one. Yeah.
Okay. All right.
Yeah.
Since we like that older music back there, let me ask you this controversial question then. What do you think about Beyonce? Is
I don't
she,
care
is
anything
she
about Beyonce.
okay? So make sure
I'm
the
not a fan.
beehive, when the beehive come for the quail, not for war. Yeah, I'm not a.
I'm not a fan. I like Destiny Child's Beyonce way better. The closer
Mm,
she got to Hollywood, the more she changed.
yeah, I agree.
I'm not a fan. I don't even know what her music sounds like anymore. Not a fan
Yeah,
at all.
yeah, I'm not a fan either. I know her concert. She was selling tickets for like $1,000, $1,500, and I'm like, people are actually paying.
People are buying those. Oh my gosh! Sounds
Oh
like Taylor
yeah,
Swift because she's pretty popular too.
yeah, but man, I
Yeah,
don't.
but no, I'm not a B fan at all.
Nope. Okay, all right. If you had to go to karaoke night, what would be your go-to song?
Mm. Mm. Wow, karaoke. Okay.
Mm-hmm. Karaoke.
Um, Luther Vandross. If this world were mine.
Oh, that's a good one. Can we get a sample, please?
Hmm.
Give us a little sample.
If this world were mine,
Oh, you can
I
actually
would
sing.
make you
Oh, I'm gonna use that the highlight clip right there.
with love untold. You've been so good to me. There you go.
There you go. All right. Yeah, you got some pipes there. Okay. I didn't expect that.
See, you
Okay.
don't know. You challenge
Right.
me.
Yeah. Have you been to karaoke night before?
Oh yeah, I love it.
Okay. Okay. There you go. I know
Yeah.
you had to do something before. What's the best vacation you've experienced, and where did you go?
I just came back from a dream vacation. I was able to take my children and my granddaughter. We got with my father, his wife, and my cousin Tacola. We actually went to Florida, Georgia,
Hmm.
Disney
Mm-hmm.
World. It was so nice. We got to stay about 7 or 8 days, so it was
Nice.
very nice
Nice.
vacation. Yeah,
Cool.
nobody had to be anywhere. Everybody was off work.
Mm-hmm.
So to be able to take my granddaughter, yeah, that was a dream vacation.
Nice. Okay, next question. What is your favorite type of food? What's something you can
Soul
always eat?
food all day long.
Me too.
Soul
Yeah.
food.
Okay. Is there anything particular you
Man, I
like?
can't eat it every day, but I love it. Fried chicken, greens, mac and cheese, dressing.
Ooh,
I
making me
like
hungry.
Italian food too. I love spaghetti, meatballs. I make my own sauce. I love spaghetti.
Hmm.
I love lasagna. Any type of pasta with like a marinara sauce. I can eat that a
Yes.
lot too.
Hmm.
Yeah, I'm not a
What's your
big
second?
seafood eater. Uh-uh.
So, what if you had to choose between soul food and the Italian? Is it close, or is it just soul food straight out wins?
Mm, soul food.
Okay. All right. I agree with that as well too. Next
Yeah.
question. How would your kids describe
Um, why did I expect this one?
you? Because they might hear this. I want to.
Um,
How do you
my
think they say mom?
they would say I'm old fashioned. They would say I'm not tech savvy. They would say I'm dedicated to the Lord, um,
Mhm.
to my church, that I'm
Mhm.
funny, that I can't dance, and I'm not as tall as I say I am. They're like, Mom, you're not that tall. I'm like, I am that tall. Uh,
How tall are you?
I'm 5'2". But they
Okay.
say I'm
Yeah.
not 5'2". I am 5'2". I know what my
Okay.
doctor says. I know what my medical record says. I am 5'2".
Right.
They would
Right.
say that I don't win as many games as I say I do. Well, they have like this big competition going on, like a big family. We're a huge board game family. We love games.
Mhm.
And I would say I win all the time. My kids are like, you haven't won a game in years. So competitive, very close, family driven, very close to my
Mhm.
family.
Okay.
I think that's what they would say about me.
Okay. Well, it just so happens I have them on the line. Let me bring them. No, I'm just
No, you.
playing. Like, oh shoot. All right.
Oh,
Uh, all
yeah.
right.
I think that's what they would say.
That's a good list. I like that. Next question is, now I know you said you were no longer married, but let's say you're going to go out on a date in, say, next couple of weeks with this guy. Two questions. Number one, what type of guy would you be attracted to? And describe your perfect date.
Um, outside of just looks, he has to be a man of faith.
Okay.
I've tried that road, didn't work when they weren't.
Mm-hmm.
So definitely has to be a man of faith.
Yep.
Um, I like to have. I don't care about the color. My first husband, my husband was white, so I'm not colorblind like that.
Uh-huh.
A nice, just a nice guy, well-rounded, funny, nice sense of humor, not stuffy. You know what I mean? Like can have fun. And I think my first date, a fun date would be. I love books.
Okay.
Um, a bookstore. Go
Ooh.
to a bookstore, pick out some books, sit down, have coffee, maybe a latte, something like that, and just have conversation
Mm,
to get
good.
to know the person, right? You don't
Yeah.
have to even
Yep.
don't even have to go to dinner. Just something where it's casual, you can have conversation, and that way you can kind of see what they like. Because if you're at a bookstore, you can kind of see what people gravitate towards, right?
Right. Yeah.
Like, what is your
Yeah.
interest? And you can talk about that interest. Like, I would gravitate towards probably house magazines because I love to decorate, things like that.
Okay.
I like
Yeah.
to read, you know what I'm saying? And I would kind of see what he would gravitate towards. And that would be our talking point on the first date.
Hmm. Okay then. That's good. So it doesn't matter if you got kids or anything. All that stuff don't matter as long as he hitting those other benchmarks. You're good. I know blended families can be a challenge.
Oh, you know what? My preference would be that his kids be grown. That would
Hmm.
be my preference.
All right.
And if they're not, obviously there's a mother somewhere lurking around in some corner, right?
Lurking.
That he has a good relationship with that mother
Yeah.
because that could be so tough. Um, if he doesn't have
Boy.
a good relationship with her and she's a
Hmm.
typical 2023 woman, and I'm not. I'm very old fashioned. I can stay home. He'd be like, don't work no more. I just put in my 2 weeks. I don't have
What?
to work. I can be on, I will stay home. I will cook. I will clean. I'm a very old fashioned woman. I don't have
Okay.
to, I have the degree and the drive because it puts much out of necessity, right? And I also want to make a difference in children's lives and other people's lives. But I can stay at the crib,
Right. I'm
no
with you.
problem, right? And
Yep.
take care of home. So it would have to be somebody who had a good relationship with their children's mother.
Hmm.
If it was drama, I'm out
Right. Yeah.
because you
I'm
have to
surprised.
draw a line in the sand.
Yeah, you don't want to put up with that. But I'm surprised you said you would walk away from that. All because I thought the education. I thought a lot of times a woman get that education that that's important. It's like
I'm
they
not a
wouldn't quickly
feminist.
tell you. Oh, okay.
I'm
Okay.
not a feminist at all.
Yeah. That's
No,
good.
very old
So.
fashioned. My grandfather worked, and my grandmother didn't have to work.
Hmm.
He really didn't want her to work. She worked because she wanted her own pocket change. She never paid a bill.
Hmm. Yeah.
He was like, "That's your grandma's money. That's her money."
Hmm.
And I just feel like women have a place in the home. Like you
Yeah.
do so much more for your children when you're able to be there.
Yes.
Um, it gives them such a foundation that they don't have when you're on a clock. That's why I always work night shift because even though I was married, my husband was home, but I was home during the day.
Hmm.
I never missed a sporting event. I never missed nothing.
Yeah. That's
So
good.
yeah, he come in here talking about, babe, I don't want you to work. Oh, you ain't said nothing but a word.
But we can
Put
get
this
it
two
out. You're
weeks
like,
on
I,
right now.
I just got off the phone from that. So
I
yeah,
just
man. Yeah,
I
that's
just feel
good
a
because.
woman has a place in
Hmm.
society for her children. Like I feel like she needs to be home if she can be, and I would surely be home. So you'd have to have a good
Hmm.
relationship with that woman, or it wouldn't work for us.
Okay. Well, secondary question off that: do you think a couple should have a joint bank account or separate accounts?
I think both. I think they should have a joint account out of what they pay their bills out of, and then I really feel like you should have your own spending money, like just a little savings account over to the side. I
Hmm.
feel like a it's a covenant. It's a partnership. So we're partners. So my
Hmm.
money is your money. Your money is my money. But I
Okay.
do feel like I should be able to have a savings account over here to the side. Like if I want to go shopping or whatever, I shouldn't have to take it out of our joint account. I do feel like people need their own money.
Hmm. But would the
Yeah.
guy have access to your account as well, to your secondary side account, or that's off
Oh
limits?
yeah, absolutely.
Okay, fair enough.
Yeah, because I don't
So.
feel like, even though that's my savings account, you should have a debit card to it. You should have
Mm,
access to it because I'm his wife.
yeah, that's fair.
I
Yeah,
don't do that shack up nonsense. Mm-mm.
right. Yeah,
Wife,
that ain't work. That's right.
wife. So
Yes.
since I'm your wife and you're my husband, like it's all transparency. Yeah, you can get in there anytime you want.
Hmm. Yep, that's good. Do you have something that, say, if you was a millionaire that you just get your eye on, or some purchase that you just want to get one day? Is it
Hmm.
that
If I
Lexus,
was a
that Beamer?
millionaire, I would take care of my children first.
Hmm.
First, I would pay off student loans. I would college fund for my granddaughter.
Hmm.
I would take care of that first,
Yes.
because you just never know. Education is expensive, right?
Yes, it is.
So I would set them up first, so they would have something. I'm a very modest person, so I don't spend a lot of money.
Hmm.
So I never really thought about the millionaire word. No, no, I'd probably pay my car off and probably drive the same car.
Hmm. Yeah, a million's
That way I
not
ain't
a
got a
lot
car payment.
like it used to be. Yeah, yeah.
Yeah, I mean, I'd pay my car off, drive the same car. You know, I don't have a lot of plans for $1 million. And what, 2000, that might have been some money. 2023, you can blow $1 million in 6 months
Right. Easily. Yeah, depending on what you do.
easily, the way people
Yeah.
shop now. So no, probably give my kids
Yeah.
some money and
Hmm. Okay.
yeah.
Yeah. Okay. My final question in this round. If you had the attention of the whole wide world for 5 minutes, what would you talk about?
I would talk about the importance of men in the home.
Ooh, very good.
I would
Interesting.
talk about the importance of not feminizing our men, not downplaying our men, especially our Black men. I would talk about the feminist movement, how it's
Hmm.
gotten out of control. Like I told you, I'm not a feminist. The women's liberation movement, that they don't need a man.
Hmm.
You do need men, and men play an important role in your families. For the
Yeah.
stability of your families, you especially need them for girls in the home, boys in the home. Women
Yeah.
can't raise boys
Oh, I say it all the time. That's so true.
on
They,
their own.
yeah.
Even
Yeah.
though me and my husband split, he still played a huge role in raising my son Jeremiah. He still does today. I
Hmm.
never tell people I was a single mother because I never was,
Right. Yeah, I don't like that term either.
even though we were divorced. I never say I raised my kids on my own. He never missed a game, took on weekends, summers, like he was always. Men are so important. And I
Hmm.
wish women would get away from this notion I don't need a man. I have a
Right.
lot of education. I can take care of myself. But I'm not going to stand on any platform and say I don't need a man. Not only do I
Hmm.
not need, I need one. I want one.
Right. Yeah.
Right? You know what I'm saying? Because I want my granddaughter to see the importance of how important it is to have a man to look up to.
Hmm. Right.
So that's what I would talk about.
I like that. And I agree with you too about the importance of the male in the house. Not saying that women are important as well, but when a male's in the house, you have kids more likely to not go to jail, not do drugs,
Mm-hmm.
not get in
Mm-hmm.
trouble with the law, and girls will make better decisions on who they date, and
Oh
men,
gosh.
yeah. So it's a lot of benefits to that. So I totally get it. And he just can't be any man. You got to be a man who's stepping up too, and doing what he's got
Oh
to
well,
do.
sure. I mean, it can't be a bum, somebody who don't want to work.
Yeah, yeah. So
And of course, you have to go down that road because people put words in your mouth. Well, you talking about a drug dealer. No, they know what I mean. I mean a man who is
a
faithful,
man's man.
a working man, going to work, coming home, being authoritative. A lot of women don't want men to say anything to their children.
Oh
What
yeah.
is your children? You know what I'm saying? Like they will stop the man from disciplining them, and they're out of
Yep.
control.
Yep. And kids pick up on that real quick. Oh, I can get away with this. He can, even your students will
Yeah.
know that. Yeah. So the
Oh yeah.
expectation.
Yeah.
So that's a
Yeah.
good point. We could have did a whole show on that. But you know what?
Yeah.
I want to thank you for coming on the podcast and giving us information here. I mean, enjoyed talking to you. You gave us so much
Thank you
insight
so much.
on the nursing field and your personal life. It's just been a plum pleasing pleasure to speak with you today. But before we go, can you tell us anything you want to clear before you go? Anything you want to make sure we're good on? Anything you want to retract or anything before we end that?
I just want people to know that you are in control of your own destiny.
Mm-hmm. Mm-hmm.
And if you work hard, you set a goal for yourself, despite adversity, you can make it happen.
Yeah,
That's what I
absolutely.
want people to know.
What can we expect next from you?
Well, you can expect next from me to finish my career tech education degree and just trying to get more involved in my students. And possibly I might be moving here soon.
Oh.
And hopefully a love life down the road. I don't know. Y'all tell me. I don't know.
Okay. Well, we're going to look forward to find out more about that because I think you're going to be okay in all aspects of that. But and
Well,
plus, you
thank
like
you.
snow too. There you go. All right. Well, let
Yeah.
me go ahead and give my final thoughts here. Woody Ward's final thoughts is this: it's never too late to be what you might have been because life can change very quickly and in very positive ways. All you have to do is let life live, and you do the same. Until next time, remember, everybody has a story to tell, but we just want to know what's yours. Peace.